Have you ever had a patient who looked completely routine, but something just didn't feel right? Let me tell you a case that I saw, never forgot. A boy came to the urgent care with his mother with sounded like nothing more than a common cold. His mother wasn't worried. She simply wanted a cough medicine. But later, he was sent to ER, where I transferred him to a children's hospital for specialized care. Hi, I'm nurse practitioner Lynn. Welcome to Case I Never Forgot. Here I share real clinical cases that taught me lessons about clinical reasoning. These stories are shared for education only, not personal medical advice. It was a busy morning. A school-age boy was brought in by his mother for fever, runny nose, cough for 3 days. His sister had been sick first. Honestly, it sounded exactly like a common virus. His mother wasn't thinking anything serious, didn't ask for antibiotics, x-ray, or blood works. His cough was the main concern. She requested some cough syrup to help him since his cough was nonstop at night. Every urgent care provider sees patients like this almost every day. Then I did a physical exam, checked his ears, nose, throat, listened to his heart and lungs. Then I found his heart rate was very fast. It's over 140s. So I double-checked the nurse's vital sign chart. It charted temperature 100.8, heart rate 145, respiration rate normal, auto said 96%, no pain. The fever usually would elevate the heart rate, but 100.8 with heart rate 145 didn't seem to fit. As I continued talking with them, I noticed the boy looked extremely tired. Every so often, he would take a sighing breath, almost as if he couldn't catch his breath. He needs extra air. His lungs sounded clear, wasn't wheezing, wasn't in obvious respiratory distress. Yet I couldn't shake the feeling that wasn't an ordinary viral illness. At that moment, I became concerned that something more serious might be affecting his heart. One of the hardest of medicine isn't recognize what fits. It recognizes what doesn't. I started asking myself, is the fever enough to explain that heart rate? Why does this boy look so tired? Why is he taking this occasional deep breath with clear lungs? Each finding by itself wasn't alarming, but together, they didn't tell the story for a routine viral illness. I sent him to emergency room. Later, I learned he was diagnosed with viral myocarditis. He was transferred to children's hospital for specialized care. The history, the vital signs, the physical examination, the child's appearance, every piece matters. Simply noticing that the pieces don't fit together. Then pause, reassess, keep an open differential. Thanks for watching. If you enjoy learning through real clinical stories, please subscribe to NP Lynn. Every week, I will share cases that change the way I practice medicine. Because sometimes one patient can teach a lesson you will never forget.